I'm Julie Bartkey with this Senate update. The procurement process used to select health plans for state-run programs through the Department of Human Services came under fire on Tuesday during a 4-hour legislative hearing. Now, when that meeting was concluded, we caught up with the chair of the Senate Health, Human Services, and Housing Committee, Kathy Sharon, to gain insight on the issue and possible solutions. Senator Sharon, approximately 4 hours hearing on this issue. First, what precipitated in your opinion, the necessity for this hearing?
After the announcement was made by the department that there had been decisions made about who would be able to manage the public programs, and UCare and South Country Alliance, which is a county-based purchasing program, had most of their book of business removed from them, there were many questions that were raised to senators and representatives, causing those people to be very concerned about the loss of services, especially to special populations who need high-risk care or who come from special communities, don't speak English, aren't familiar with the healthcare system in the United States, that need a little bit more than just an appointment with a physician or an advanced practice nurse.
So encapsulate, if you can, the takeaways from today's hearing. What did you learn that you think deserves either more conversation in the future or possibly legislative action?
Well, this was a 4-hour hearing, so to encapsulate that would be very difficult. But I think some of the central messages were that for the healthcare savings that are being proposed from this procurement, the questions were raised about what would be lost. What would be lost in terms of what county-based purchasing does with their money to provide new initiatives or to do wraparound services for people who have special needs. There were questions that said, is there going to be a loss in the unique character of how services can be provided to special populations? In the case of UCare, there was the question of their really dedication to the new immigrant communities and to the high-risk populations who are difficult to serve because of mental illness or chemical dependency, and how they have really focused the way they serve with more than just providing the specific health care intervention, but the wraparound services that go along with that. And what are the assurances that those things will continue to exist with those who now have won the procurement process?
And so based on today's hearing, in your opinion, is the procurement process flawed?
I think the procurement process is limited, and we are going to have some negative outcomes from it that are more severe than the value of the cost savings. That's the impression I got from the legislators here today. I know that the commissioner does not agree with that she thinks that many of those issues should be looked at and resolved through the process of I can't remember the term, the mediation, the appeals process. There's an appeal process. And so I know that the commissioner would like to proceed, even though the recommendation from several on the committee were to slow this down or maybe to reconsider what we're doing so that we don't have the losses that we're afraid of. But what the commissioner was saying, that there's an appeal process, that some of these things can be looked at that time, and that process may be able to help us resolve the concerns, some of the concerns that were expressed here today without completely backing away from the bid process.
And finally, Madam Chair, is it a safe assumption that this is not the last we've heard of this issue in your committee?
I'm certain that this will not be the last that we will be taking a look at how we're doing procurement process. There will be many recommended changes to the procurement process, many recommended changes for when information can be divulged so that people can really understand the implications of the bid process, and also whether or not special programs such as county-based purchasing should be treated differently. So all of those questions will emerge in our committee in the future. But for today, I think what we heard was deep concern about how we've applied a procurement process, what we may have lost, whether or not we've actually created cost savings for the state that are equivalent to the other things that are lost at the county-based purchasing level or for services for very difficult populations.
Senator Kathy Sharon, thank you for taking time after this lengthy hearing to talk with us.
Yes. Great meeting, great time, and a difficult subject. The public wants cost savings in healthcare, and so it's it's important for us to try to pursue that. But we may have used a process this time that did not consider the cost savings that come in some of these programs that serve special populations, keep them out of the emergency room, get them into the less cost provision of care, transport them to their appointments. Those have costs that really have cost savings in the future. And whether or not those things were adequately assessed in the bid process is a question that many members of this committee were asking.